Hello, my name is Rakesh Popat, and I'm a haematologist and associate professor based at University College Hospitals in London in the UK. The treatment paradigm for multiple myeloma continues to change with the evolution of new treatments. Patients who typically relapse after first-line therapy have a number of different options that they can receive at early relapse. Currently, the mainstay of treatments at early relapse typically are around CD38 containing regimens such as daratumumab plus bortezomib, or daratumumab or isatuximab and carfilzomib, or pomalidomide-based combinations. These treatments can be very effective and in some cases can provide durable responses. But it does mean that the patient often ends up coming to hospital very frequently to receive potentially weekly or fortnightly based treatments long-term until disease progression or relapse. What's very interesting is that we've now seen the development of BCMA-targeted therapies that started off in the late phase stage for patients with multiple myeloma and are rapidly moving into earlier phases of treatment. One of these BCMA-targeted therapies, known as belantamab mafodotin, is now licensed in the UK for patients who have had at least one or more prior lines of therapy when combined with either bortezomib and dexamethasone or pomalidomide and dexamethasone, and we anticipate approvals to be global very shortly. Belantamab mafodotin is an antibody-drug conjugate that targets BCMA and has demonstrated single-agent activity in previous clinical studies. But what's particularly interesting with these combinations is that these treatments have been shown to be particularly efficacious. The combination with bortezomib and dexamethasone gives a median progression-free survival of 36 months, and similar efficacies are seen with pomalidomide. Indeed, the combination with bortezomib and dexamethasone also improves overall survival. And so I think that this combination is now considered to be a standard of care for patients with second line and third line, particularly because it improved progression-free survival and overall survival compared to daratumumab, bortezomib, and dexamethasone, which is currently one of our standard treatments. And what we know about this combination is that whilst it is a very effective treatment, it can cause some ocular toxicities. And so it's very important that the dosing schedule is correct. In the clinical trial, belantamab mafodotin was given every 3 weeks, but actually when you look at how often it was given, it is typically given every 6 to 8 weeks, and then stepping down to 12 weekly in more of a maintenance schedule. And so certainly in my practice, I will be giving it every 6 to 8 weeks for the first 6 to 9 months before moving on to a maintenance schedule of 3 monthly treatment. Looking towards the future, there will be new BCMA-targeted therapies coming through, and of course we then need to think about how we should best sequence them. The bispecific antibodies are currently available at fourth-line treatment, and CAR T-cell therapies can be available at first relapse and beyond. In general, we do recommend CAR T-cell therapy as early as possible to maintain T-cell fitness, and so particularly for cilta-cel, this should be considered in patients appropriate for that. But it is certainly possible to be able to give sequential BCMA-targeted therapies, but what is important is to leave adequate time between them. Real-world studies suggest that this interval duration should be approximately 6 months. So if you were, for example, to give belantamab VD at second-line therapy, then you would want to have at least a 6-month gap before commencing therapy with a BCMA bispecific therapy. So in summary, the future for patients with early relapse multiple myeloma is widening with the treatment options that are available. Certainly, belantamab mafodotin combinations with bortezomib and dexamethasone or pomalidomide and dexamethasone are appropriate, but we also need to be thinking about CAR T-cell therapy and BCMA-targeted bispecifics, which are also available later on down the line.